We're now live. Welcome, everybody. My name is Tim McMahon. I'm the marketing director here at St. Joseph Hospital, and we're very thankful to have you with us tonight, where we'll be talking with a few of our experts all about running. Now, tonight, the experts we have with us are on the top of your screen. We have Scott Durfee and Kristen King. Scott is a marathoner, currently training for the Boston Marathon, as well as one of our physical therapists. And we also have Kristen King, who is a certified running coach and is training for a half marathon. And she's also one of our physical therapists here at St. Joe's. And then at the bottom of the screen, we have Dr. Michael Kelly. Dr. Kelly is a podiatrist with St. Joe's. And so he'll be helping to answer some of the questions around, common foot injuries and, certainly some of the treatment options that he might handle with runners. So again, tonight's conversation is really just about proper training methods for running. Things you can do to improve your running. Types of shoes you should wear. The impact of running on your feet, and of course, what kind of injuries people often have when running, and then how to recover from those injuries. What treatment options are there? Certainly surgical versus non-surgical. And really then answering any of your questions that you might have throughout the broadcast. So if you have a question for any one of our experts, again, really anything around running, around training, please feel free to ask. There's a comment section below. Just type your message in the comments and we'll see it as they come up. And then we can ask our experts live right here on Facebook. And of course, if you missed tonight's broadcast, this is automatically recorded so you can watch it later as well. And you can also ask questions later as well, and we'll have our experts answer them at that time. So with that being said, I'm going to get us started off here. And I'm going to ask Scott and Kristen to give you a little more information about themselves and their background in running, as well as what they do at St. Joe's Physical Therapy. Go ahead, Scott and Kristen.
Oh, okay. Hi, everyone. I'm Kristen King. I've been working for St. Joe's for about almost 18 years now. I work primarily with orthopedics, have seen a fair amount of runners as well. I'm a runner myself, so I've treated myself in trying to get back to training and everything, and hopefully not lose any time with that.
And my name is Scott Durfee, and as Tim said, I'm currently training for the Boston Marathon. This is my third Boston Marathon. So we're in the taper time for Boston, and I am a physical therapist for St. Joseph's Hospital. I've worked here for 2 years, used to work at Elliott Hospital up in Manchester before, and also did some time with a private clinic and worked with a lot of runners throughout the years. And I also do running analysis, so we can try to watch people run on the treadmill, film them, and break down what we need to really work on to help them prevent injuries. And that's mainly one of the goals that I like, is to help people prevent getting into running injuries before they happen.
Now, do you see a lot of injuries from runners that come through physical therapy?
I do, yes. Yes, quite often. A lot of knee pain is usually what we have.
Yeah, and I also find that we get a lot of people with like Achilles problems, Achilles tendinosis,
Sure.
Sometimes posterior tib tendinosis as well.
And that's one of my problems that I always run into, is posterior tib.
Great, thank you. All right, Dr. Kelly, same question. Introduce yourself, and tell the audience what you do and more about podiatry and connection to running.
Sure. Dr. Michael Kelly. I'm one of the podiatrists here at St. Joseph Hospital. I have never run a marathon, nor will I ever likely run a marathon. However, I have worked the Boston Marathon medical tent in the podiatry section for several years, as well as several years at the Chicago Marathon as well. I do see, marathon runners and kind of your weekend warriors, 5Ks, 10Ks, and so forth. So I'm well-versed to the running patient.
Great, thank you. And I'll just say for myself, I'm a terrible example, or actually a great example of what not to do when training for a marathon, because I also ran Boston. Well, I ran up to mile 18 actually, and then I jumped in my mom's car and jumped back in at mile 22. I wasn't an official runner; I was a bandit. But I had to finish the race because my wife and my future mother-in-law were at the end, and I had to tell them for years that I finished the Boston Marathon because, as far as they knew, they didn't see me get out and get back in. And then I couldn't walk for about 3 weeks after that because I didn't train. So, there's while I have plenty of experience running, I'm definitely not the the person to get good advice from. So I'm thankful we have you guys here that can actually give legitimate advice on how to run a marathon and how to train properly. So, like I said, tonight we're gonna kind of go back and forth with questions, and of course, our experts, chime in whatever you see fit. But we'll start off with Scott and Kristen. One of the questions that I'm sure you guys hear from whether they're longtime runners or people who just want to start getting in the running. One of the questions you hear is, where do you start? If you're training for a half marathon or a marathon, do you just jump right in and start running 5, 10, 15 miles a day? Or, do you start slow? What's kind of the best process?
Well, it depends on their fitness level. A lot of times what I'll do is I'll start with the run-walk method. And so you run, and then depending on what the fitness level is, you would walk for a little bit. So maybe start off with running for a minute, walking for a minute, running for a minute, walking for a minute, depending on what they want to do. You want to, if you've never run a lot, training for a half marathon, you definitely want to build up that time. So you'll get these training plans, but what you have to do is you have to be already running quite a bit before you start the even training plan, because usually a training plan for a half marathon is anywhere from 12 to 16 weeks. But you already want to be up to at least 3 to 5 miles with it before you start that training plan. And the way that I start people when I train them is I start with the run-walk method.
Yeah, and I would definitely say a lot of the training programs you have out there, you really want to have a good base built up, as Scott was saying, because there's so much loading through the whole body as you go. I mean, you're loading 3 to 5 times your body weight while you're running for each footfall. So you're getting a lot of impact. And if you go too fast, too soon, you can definitely have injury, breakdown, stress fractures, those kind of things. So you have to be gradual. Most of the training programs you see out there, they really want you to have a good base of running before you start. So for 5Ks, maybe they want you to run like 3 times a week up to 30 to 40 minutes before you start those. And definitely for a marathon, they're looking at investing probably 8 to 12 weeks before you start a program. Most of the time, you want to have your base at about half of what your total distance is going to be for the race. So that can help prevent some of that risk of injury.
I'll add that probably overuse and improper training are probably the 2 biggest reasons high impact sports such as running can cause not only damage to the foot and ankle that I see, but also to the knees, the hips, and the lower back as well.
So, Dr. Kelly, kind of with that in mind, you said there's, damage to the foot and ankle. What would you typically see? How would a runner know if they had a foot or ankle problem, potentially from running, that would require them to come see someone like yourself?
Sure. There's certainly the visual things, whether that be blisters, toenail damage, and those can be attributed to a number of different things. Most often it's either improper shoes, whether that be they're too tight, meaning that the toes are getting squished, or if they're too big and then you end up sliding in the shoe and you can cause damages to the nails. Blisters are usually caused by excess friction, and other things that we can see, whether there's some type of underlying joint arthritis, Achilles tendinitis, and plantar fasciitis are 2 very common things. Then there's stress fractures. Sometimes people can develop calluses, which are usually pressure overloading in a particular area. as well as athlete's foot. That's another visual thing. And usually because fungus likes to grow in hot, moist environments, and when people are running, the foot can certainly be a harbor for fungus to grow.
Wow, you're really helping me realize why I don't run anymore. Thank you. It really sounds like a very dangerous sport. But you mentioned shoes, right, and improper fit and that kind of thing.
Yeah.
So I'll go back to Scott and Kristen. There's a million shoe options out there, and obviously some of the bigger shoe companies have great marketing of like, this is the best shoe for running. This will make you faster, jump higher, whatever. Do you have recommendations on what type of shoes people should wear, for marathons, for half marathons, 5Ks, training?
For me, what I do is I analyze I'll analyze them on the treadmill, and I'll look to see what their foot's doing, and we can slow down to see exactly what's happening. And then I usually make my suggestions from there. There's so many shoe companies out there that I do have my favorite shoe companies that I steer people to. I use New Balance. I find New Balance works for me, just because of the cushioning, and I need a little bit of a pronation stop because I'm a quick pronator, because I land on the outside of my foot and pronate really fast, which is a natural thing, but you don't want it to be too fast, because that's where you get the posterior tib. So basically, if you get something that has an arch and blocks it, it will help. So I like New Balance, Saucony, Brooks, and Hoka, pretty good. So those are some of the shoes that I steer towards. I might have missed one or two in there.
I generally use ASICS shoes, but
ASICS, I missed ASICS.
Yep. But really, it's going to depend on what their foot is doing, because there's cushion shoes, there's motion control shoes, there's neutral shoes. So there's a lot of, besides just being a lot of different companies, there's different types. So it can be a little difficult, I think, for the average person just to go out and purchase shoes.
Yeah, it's really hard.
Yeah, having someone to kind of steer you toward the right shoe is always helpful. I do find that there are some places like Runner's Alley and some of those that will have you that you can go on a treadmill and they will help you find the right shoe, because you definitely don't want to do what I started to do initially, which was just be like, oh, that one looks nice. As long as it feels comfortable, I'll go with it. Because you're going to wear these shoes for a while,
Yeah.
So you want to make sure you know what you're getting.
Yeah, Dr. Kelly, I remember I saw you probably a year ago for a foot issue, and I remember you had a whole list of different types of shoes for different issues. Do you have any preferences? I mean,
Yeah, I mean, I think my preferences with regards to shoes are the same that have, already been discussed. ASICS, New Balance, Saucony, and Brooks. I tend to be a big Brooks fan. But, I can't overemphasize the importance of making sure that you have good shoes, because it's something so simple that can lead to an injury very quickly. And the last thing a runner wants to hear, especially when they're training for something like Boston, is, a few weeks to go, and then all of a sudden, they go out for a light little run, and it just takes a little tweak, and then all of a sudden something happens, and then they end in my office. And, I tell them, well, you maybe shouldn't run, and you're going to take that risk by doing that 26.2, and no runner wants to hear that. And so your shoes definitely play a big role. I think people should have dedicated running shoes. There's different variations on how much mileage people would say you can put on it. I would go less on the mileage and more on the look. There are always tread patterns on the bottom of the shoe. And particularly with marathon runners, I think once you start to see that tread pattern fade away, which is typically going to be across the sole, the ball of the foot, and then the outside of the heel. Once you see that, it's time for a new pair of shoes. Some marathon runners, that could be, anywhere between 2 to 6 months.
Gotcha.
Can I hop in for a second? One also thing that for sneakers and shoes is that your running sneakers and your running shoes, That's what they're used for. So you put them on when you go for a run, you come home, you take them off, because walking and running are going to wear your shoes in two different patterns.
Mhm.
So your running sneakers are your running sneakers. That's it. You put them on, you go out for a run, you come back, you take them off, right? Until your next run. That's when you put them back on again. So that's a really important point because of the wear and tear on the sneakers between walking and running.
Interesting. I didn't know that.
Adding on to that a little bit, I mean, people have different what we call strikes of running, whether that be a heel strike or a forefoot striker, and there's certainly different pros and cons to each, and advantages and disadvantages of each that make people more susceptible to injury. So I think, if you are serious about running, I think at least getting an evaluation or linking up with a running coach is important to not only identify those, but where are your areas of weakness that you can kind of strengthen to not only improve your stride, but your efficiency of running as well.
So with that in mind, we had a comment coming on Facebook. I'll put it down here from Becky saying, "I want a running eval." So that begs the question: if both Scott and Dr. Kelly both mentioned getting evals, where does someone get a running eval? Is that something we do in physical therapy, or is that something you need to go to a specialist for? How does that work?
I mean, we can certainly evaluate that here. I'm not sure about all the logistics with insurance and that kind of thing at this point, but I've certainly been trained in running gait analysis, looking at how people are loading and giving them programs, looking at their mobility, stability. Both Scott and I can certainly do that, and look on the treadmill and give a gait analysis and figure out how to make people more efficient in their running pattern and running form.
And we're actually working on getting this in this clinic where we can analyze runners, where we can get it onto like an iPad or whatever. We just have to find the logistics of how we can do that for patient privacy and all that stuff. But usually what I do is I take the person's phone and I film them on the phone, and then we slow it down and I show them. So usually with patients that come in, that's when I do it.
Gotcha. Now I have to ask this, and I haven't seen it in a long time, but I remember there was a time, and maybe it's still out there, where people were wearing those those finger shoes. You know what I mean? I can't remember what they were called, but right? Because they had it was like to make it feel like you're running barefoot, but give you a little protection. Is that still a thing? Do people still wear those? Was that a good idea?
The thick shoes or the thin shoes?
The thin ones, right? It was like
thin.
They're like foot gloves. Yeah.
They're like foot gloves. Yeah.
They're the Vibram 5 fingers.
Thank you. I was like, I knew finger shoes, right?
And I haven't run in them a whole lot. I've certainly used them, and I do think they play a big part in getting some of your stabilizer muscles in your foot working a little bit better. I certainly saw that afterward. But it's going to be a hard thing. You never want to go from having a very well supported to something that doesn't have any support. That's going to be a huge change on your foot. And I actually have seen people have problems and injuries because of that. So we do have to be careful of that. It's definitely a thing. If you're looking toward going that way, you have to, wean into it and be very gradual about changing. And I do think there are some people that it's just not for them.
Yeah, if you have a really hyper mobile foot, I would not recommend those because there's nothing to help stabilize your foot with those on. So you need kind of a stability sneaker for that. For somebody that has a really unstable foot with a lot of motion, like I could not wear those because my foot moves too much. So I need some sort of stability. So I would not recommend those for somebody that really needs that stability.
Yeah, there's a huge barefoot running craze. Probably the most recent cycle, I want to say, came back in probably the late 2000s.
Mm-hmm.
Dan Lieberman, who's I believe a PhD, came out with this book, Born to Run. He studied a group of individuals in, I believe it was Copper Canyon, Mexico, where a lot of them, they don't wear shoes there. They can't afford shoes. They'll have, I think they call them Hirachi shoes. It's basically like sole of rubber with a sandal tongue on the foot. And it was this craze of how can these people run these long distances barefoot? And what does that do to the foot? And are there advantages of training that way? I personally am not a big fan of it. I think the average runner is too susceptible to injury. If it's going to be done, it needs to be under some type of medical guidance of someone that can really watch you do it. Stress fractures and fractures are the biggest thing. And also, that style of running is going to change the way that you run normally. Most people are by nature heel strikers. It's mean that when they run, they have usually a longer stride and they strike at their heel. The barefoot runners or minimalistic running, people tend to strike their heel at kind of the middle of the ball of the foot. And although that's kind of viewed as a more efficient way of running and probably even less prone to injury, your body needs to work and really train to get up to that point.
Mm-hmm. Agreed.
Thank you. We had another question come in, and the question was, what do you mean by my foot moves too much? So I think, Scott, you were saying your foot moves too much, so that's why you couldn't do that.
So what I mean by that is I land, and I discovered this when I was running in a light snow one time, that I run in a straight line. So I cross my feet. So I'm running in a tandem stance. So I land on the outside of my foot. So what I mean by my foot moves so much is I have a quick pronation, because when you hit, what should happen is you should hit your foot. It should pronate, and then you're going to rock out of it like that. All right. So mine lands on the outside and drops really fast. All right. So it overpronates really fast. And so then I come up out of that. So that's why I need some sort of shoe that's going to help slow that down a little bit for me. That's what I mean by my foot moves too much.
Got it. Thank you.
Mm-hmm.
And we have another question that just came in, and the question is running a marathon really good for you? So you hear a lot about people who train long distance and the effects on your knees and joints and ankles and all that stuff. So is it good for your body? And obviously, Sky, you're someone who runs a lot of marathons. So but you've probably also seen people who it's probably had a negative effect on, too much running and overtraining. So what's the balance, I guess?
I don't think it's a bad thing to run a marathon as long as you train properly for it. There's a lot of stuff that you have to do. Your diet's going to be important. You have to learn how to eat while you run, so you can fuel yourself as you're running. That's a big need while you run a marathon. Do I think it's bad for you? No. As long as you put the time in and train and just are really careful with your running, and if you're not a runner by nature, I would definitely recommend having somebody guide you, at least some sort of running coach that helps you along. But I don't think it's bad for you. No.
I would say that running a marathon is definitely a lifestyle event. You have to be able to gear things around running and make sure you're putting the time into the training, as well as making sure that you're allowing for enough recovery for afterward, because it's a lot of work, and it's a lot of strain. It can be a lot of strain on your body. So you need to be able to make sure that you're recovering well so that you can, commit to that long of a training program as well.
And I actually had x-rays a few years ago of my knee, and I've run my entire life. It's rumored that I ran home from the hospital when I was born. But I've run my whole life, and my knees in the x-rays were perfectly fine. I had great spacing. There was no wear and tear on my knees, and this was taken a few years ago. So as long as you run properly and you're not jamming your knees and sending all that force up through your body, and you're really soft on your feet. And that's one of the first things that I talk to people about is when they are starting to run, is the first thing I want them to do is listen. I don't want to hear a lot of banging on the ground. That means you're there's too much force coming up through your body. So you need to soften that. So it has to be very, very soft. When you watch the Boston Marathon, if you ever go live, you'll see the elite runners come by and you can't hear them. They're so soft on their feet because they absorb everything as they're running. And so I would recommend, if you're going to run a marathon, learn how to do that. And that's where a coach comes in to teach you how those little things that will help you learn how to absorb those forces so you're not just jamming all the time.
That's good to know. Yeah, I guess I've never paid attention to runners running by, so you don't think about how soft they are when they're going by you. So
because one thing I was told by a running coach once is, if you're coming up on somebody, they shouldn't hear you. Like they should go. You know, they should be startled when you come up on them. You should be very quiet that they can't hear you coming. And it's hard to learn that, because I was at a race yesterday, watching my supervisor actually run a 20 miler. She was good, so I'm not going to call her out, but there's a lot of people. All you could hear was the boom, boom, boom coming, and they're just taking too much force up through their body, and that's where you'll run into those injuries.
Great, thank you. Now, Kristen, earlier on in the broadcast, you had mentioned something called Achilles tendinosis.
Yep.
And something you had gone through. So, what is that? How would someone know they had it? What's the treatment for that?
So with the Achilles tendinosis, it's generally you can have a tendinitis, which is more an acute problem where you have an inflammation going on. Over time, that can change into a tendinosis where you actually have some degenerative changes going on in that, and that's just more of kind of the chronic term for that. I found personally when I had it that I was getting a lot of pain, a fair amount of pain that made me actually stop and walk for a little bit, probably within the first half mile that I was running, and then definitely on hills. So it took a while for me to get rid of it, because I was just trying different things. And, I had some medical advice saying, oh, just rest it. That actually made it worse. So I was like, okay, I can't do that. And then I was reading up a lot on it, and with any kind of tendinosis issue or tendon issue, it needs some kind of load. The part is you don't want to overload it. So you can't just go out and keep running on it and expect it to get better. So what I needed to do was I needed to work on some of the strengthening in my calf muscles, and doing that with some load. So I got a little bit of discomfort, but not enough that was really bothering me afterward. And I also worked on some of those intrinsic muscles in my foot to help with stabilizing. And, within probably a few months, I wasn't having any pain any longer while I was running. So it's really about working more of the muscle eccentrically. So that's more when you're lengthening the muscle. So you think, okay, I'm going to do some heel raises, but it's more when you're kind of lowering down off that heel raise. I will say there's also different kinds of Achilles tendinosis. You can have it more higher in the tendon or more where it inserts on the heel. I had it more insertional. So with that, you don't want to go as low. So you don't want to go off a stair and have your heel go below the stair. You only want to go to about neutral, because otherwise that can stress that area a little bit too much.
Gotcha. Thank you. That was a great explanation. Now, Dr. Kelly, I was wondering if someone is training and they have a foot injury, whether it's I guess it could be anything from a sprain to, something just doesn't feel right, during their training. What would generally be the process? Would they go to their PCP first? Would they go straight to a podiatrist, to you? Would they go straight to physical therapy? What do you typically see as the process when someone has an injury of the foot?
Sometimes insurance can dictate that process, unfortunately.
Sure.
People with HMOs or are on some form of whether it be Medicaid or a managed care plan, those typically need at least a referral from a primary care physician. It doesn't necessarily mean that the primary care needs to see them. Different hospital systems are different. I think our system's pretty good. If you called up your primary care and they're part of St. Joe's and said, I wanted to see Dr. Kelly. I have a foot issue. I don't think most of them are going to have any problem with just punching in that referral and having them see me. Other people's insurances, they don't require that referral per se, and they can essentially just call my office and schedule an appointment. If people aren't aware of whether they would need a referral or not, then they can certainly just call our office, and our front desk can let them know whether a referral would be required or not.
And what would you say is the number one foot injury you see?
Probably plantar fasciitis and Achilles tendinitis. And plantar fasciitis is almost essentially the exact same thing that was just described for the Achilles tendinitis, except it's on the bottom of the foot. And it's a ligament that attaches at the base of the heel. And I usually attribute this to three things. It's bad shoes, lack of arch support, and tight calf muscles.
Yep. And so what's your treatment usually for that kind of thing?
I treat those exact three things. I'm looking at the types of shoes that they wear. I'm doing kind of a small little gait analysis. I'm looking at them stand up. I'm watching them walk. I help try to steer them towards a good shoe to go purchase. If their shoes aren't really the problem, then I will look a little bit more towards possibly an insole. There are a million different insoles out there, or orthotics. They are not all created equal. And I would really encourage people before they start to just go buy whatever they see on TV or the 100 different ads you might see on Facebook or Instagram or whatever, to get an evaluation. Don't waste your time. Don't waste your money on products that aren't going to work. I really do think a lot of products that are out there, it'll be targeted towards plantar fasciitis, but how a lot of these companies haven't been sued for false advertising is beyond me, because it doesn't, you have to really hit the root of the problem. And a lot of those products just don't do it.
All right. Good to know. We just hit the 32-minute mark. So I'm going to wrap it up here we have a quick question on the sidelines here. How long would it take to get an appointment? And this is for both of you, all three of you. How long would it take to get an appointment with physical therapy? How long would it take to get an appointment with Dr. Kelly? So Scott and Kristen, if someone wanted to make an appointment, assuming insurance, wasn't an issue, could they get one this week? Could they get, or are we weeks away?
Well, they have to get a prescription from a doctor to start off with, so they can get referred to physical therapy. And right now, it's probably a week or two out, I believe.
Okay.
Our schedules are pretty tight right now, but we're discharging people all the time, so it usually takes a couple of weeks to get in.
Yep. And just as a reminder, the two of you work out of our physical therapy practice at Exit 8 in the Dartmouth Hitchcock building.
Correct.
Yep.
Great. And Dr. Kelly, same question. Any thoughts on how long, how far out you're booking and so on?
Schedules kind of book up in waves. Sometimes parts of the year are slower than others. Usually the first part of the year, when everyone's deductibles start over, less people want to go see someone. But usually before as the summer starts approaching, sometimes just after the summer, and then definitely at the end of the year. So it really cycles, but you never know. Just call, ask, and see when the next appointment is available. But sometimes it can be anywhere from 1 week or same day if there's a cancellation, to maybe up to 3 to 4 weeks.
Great. Well, again, I kept you guys on here for 34 and a half minutes now, so I want to give you your time back, which you all want to get home to your families. But I want to thank you all for coming tonight. Thank you for sharing your expertise with us. I think we answered a lot of great questions. Unfortunately or fortunately, I think that this conversation could go on for quite some time, because there's so many aspects to running and the foot that we could answer. But I think this was really helpful, and I appreciate everybody who was watching and for asking your questions. And again, if you have additional questions, please feel free to continue asking them. We'll follow along on Facebook after this broadcast is over, and of course, do our best to answer them at that point. So thank you again, Scott Durfee. Thank you, Kristen King. Thank you, Dr. Kelly. We appreciate we appreciate having you guys this evening, and we look forward to seeing you guys again soon. So thank you, guys.
Thank you very much.
Thank
Thanks
you.
for having us.